I want to help you pass the NCLEX exam. You see, the NCLEX has now metamorphosed into what we call the next generation NCLEX. It assumes that you are in a typical American hospital where you have all the available information at your disposal, all the resources at your disposal. So you have the patient's vital signs, you have the medications they are taking, you have all the labs, you have their history, you have all the data about this patient, and they want you to combine all that to make the best decision in the interest, in the well-being of that patient. It's like when I ask ChatGPT on my phone to answer a question that I have. What it does is to combine all the available sources of information on the internet, and it comes up with the best answer in its ability. But now the NCLEX doesn't want the patient to be in the hands of artificial intelligence. The NCLEX wants the patient to be in the hands of the best human intelligence. That's why the best skill you can have as a nurse on the NCLEX is what we call critical thinking. To be able to combine all the data that has been given to you, vital signs, labs, patient's history, medications, and then you say, this is the best answer based on the information that you have given me. So, like in this question, you see the patient's history, you look at the labs that have been given, you are like, okay, I see that the patient's creatinine is elevated, but that doesn't concern me at this time. You see the vital signs, you see that the blood pressure is low, you see, yeah, it's understandable because the patient came in with anemia. But then there comes these classic signs of blood transfusion reaction, and you are like, in all your knowledge, in your nursing background, you know that blood transfusion reaction can easily lead to anaphylaxis, to anaphylactic shock that kills the patient faster. So that in your nursing brain must trigger a very fast response. And what is the nursing action to stop the blood transfusion immediately? There are other shiny answers there, like call, notify the doctor, but this exam is not for doctors. The NCLEX wants to see your nursing judgment, your nursing action fast. That's why your nursing knowledge is very important, but not as much as important as how you apply it. That's why I say content is king, but apply that content very well. That means that you're ready to understand and your mind is free to apply that knowledge in the scenario that you are given. Get your content right and develop your critical thinking skills on the NCLEX, and you will always be able to choose the correct answer. You will be fine. You will be fine. You will be fine.